Good day, ladies and gentlemen. I'm Dr. Ingky, your digital skin doctor, and today we'll be doing something different. I'll be answering your questions from YouTube comments. So let's get on to the first question. So question number one is, I've been using retinol for 0.1% for about 4.5 months, and then I've switched to 0.3% retinol. Currently, I have been using retinol for 9 weeks and 6 days at this strength. My skin is fine, but I feel that I'm not seeing much improvement. Can you please advise me on whether I should continue retinol or stop it? For context, I am 21 years old. Retinol is a main anti-aging agent. What retinol does is increases the strength of your collagen and increases the rate of growth of your collagen. So retinol is great for someone who is facing aging issues. Example, fine lines, open pores, and even if you have textured skin. However, at 21 years old, you are unlikely going to be encountering any of this issue, maybe for textured skin. So if you're using retinol at such a young age of 21, you might just want to continue for the sake of prevention, or I would say delaying the aging effects. However, if you feel that retinol has not much contribution to your skincare, you might want to swap it out for something. Maybe you're facing dull skin, you can swap it out for vitamin C, or you can swap it out for something like green tea extract, which helps reduce skin sensitivity. But in my opinion, if you're not seeing any results, but you're not seeing any negative results from retinol, you can just continue retinol for the sake of just maintaining your skin's health and delaying the aging symptoms. Next question, would you recommend retinol in squalene by the ordinary for someone with seborrheic dermatitis? Thank you in advance. Now, for someone with seborrheic dermatitis, there's this overgrowth of yeast on the skin which causes seborrheic dermatitis. Now, if you're using retinol with squalene, there is no issues if you are encountering seborrheic dermatitis. You can actually use it. It is actually pretty safe. However, one of the main things that might occur when you're using retinol with squalene in seborrheic dermatitis is you might see that your skin gets extra oily, which may trigger more of your seborrheic dermatitis. And if that happens, you might want to just stop it. But most cases, there should not be a problem of using retinol with squalene. Now I'm going on to the next question. What is the right time to put on your retinol? Now I'm not sure whether this is retinaldehyde or retinol, but it doesn't matter. Now retinaldehyde, retinol, retinoic acid, all of these are under the vitamin A category. And vitamin A should only be applied at night. The reason being is that vitamin A reduces its effectiveness and gets deactivated when exposed to UV rays. It means that if you use it during the daytime, you might not see the best results from your vitamin A creams or serums. So the best time to use it typically is right before you sleep. Clean your skin, make sure it's nice and bare, and then apply your vitamin A creams and serums on top of it for maximum results. And do not forget to moisturize during the night and apply sunscreen during the day. Oh, we have a wonderful question here. Can I use niacinamide serum and kojic acid at the same time? Now, the short answer is yes, you can use it at the same time. Kojic acid is typically known as a skin brightener. It reduces the amount of pigmentation and melanin in your skin. Niacinamide, on the other hand, is a soothing ingredient. It can help trigger more collagen production and helps reduce sebum production of your skin. Now, how would you apply if you have both niacinamide and kojic acid? Now, in some cases, there are certain products whereby niacinamide is premixed with kojic acid. Now, if you do not have that and you have standalone kojic acid and standalone niacinamide serums, here is what I would suggest. Typically, when you clean your skin, whether it is during the day or the night, you might want to put on the kojic acid serum first. Kojic acid, being acidic in nature, typically should go on first because acids are better absorbed by your skin when it's applied bare. After that, typically 1 to 2 minutes after applying your kojic acid, you can now layer it with niacinamide. Niacinamide is typically more of a neutral kind of pH, so when applying on your skin, doesn't irritate your skin. And after applying your niacinamide, do not forget to top it up with either your moisturizer or sunscreen. Right, Salam Doctor, I'm your follower from Pakistan and my age is 26 years old. I have oily skin, melasma, and open pores. Please tell me your treatment. Now, before you step into any clinic or any beauty salon for any sort of treatment, the best way to treat your skin is actually through topical products or through skincare. So let's tackle it part by part first. First up, you mentioned you have oily skin. Oily skin does trigger open pores. Why? Because the sebum stuck in your skin can cause this dilation of your pores and make you look like your pores are actually much more stretched. So the way to actually reduce it is to use ingredients that can both dissolve the sebum in your skin and to reduce the amount of sebum that your skin is already producing. So first step is to use a salicylic acid cleanser around once a day or once every 2 days. Now what salicylic acid does is it binds to the sebum in your skin, dissolving it, making it easier for you to, when you're washing it off, for the sebum to actually flow out of your skin. Secondly, you could always use a niacinamide serum or cream. What niacinamide does is it helps manage the sebum production, reduces sebum, and at the same time, closing up those open pores. You could also use adapalene at night. Now, adapalene is a form of vitamin A. Typically, it's a prescription base. And what it does, it further enhances the reduction of sebum in your skin. So typically, adapalene is applied during the night time. Now, when you clean your skin and you use niacinamide serum and you apply adapalene, a lot of times you'll be able to see that your skin is less dull, it's less oily, lesser oil production, lesser acne, and at the same time, open pores will be lesser. And side note, niacinamide also helps reduce melasma as well. Now, let's talk about melasma. At the age of 26, typically melasma is kind of rare, so it might be an early onset of melasma. And what you should do is, just by using sunscreen once or twice a day itself will be a treatment for melasma. Just using sufficient SPF, between SPF 30 to SPF 50, will be able to reduce your melasma tremendously without even applying any melasma creams on your skin. Niacinamide also helps reduce melasma. Now, after using both SPF and niacinamide, and you have noticed that your melasma isn't reducing at the speed that you wish, you can always add on things like vitamin C serums during the daytime, and they also help control and reduce your melasma. If all of that doesn't work, you can walk into most clinics and get hydroquinone creams, which are prescriptive strength creams to reduce active melasma. Okay, next question. I have mild pitted scars and I have acne when I was 11 years old to 18 years old, but with active acne, my acne is now treated, but even after using everything, my skin is still oily, like I've poured a liter of cooking oil, have congestion and pitted scars. So what we're dealing with is uncontrolled sebum production, and at the same time, we are dealing with pitted scars from old acne scars or old skin trauma. So first up, to reduce the amount of oily skin. So salicylic acid cleanser with niacinamide serum, they both help reduce the amount of oil in your skin, help decongest your skin as well, and niacinamide helps regulate sebum production. During the nighttime, apply adapalene or tretinoin. They're both prescriptive vitamin A creams, which are very effective in reducing oil from your skin. Do not forget to apply sunscreen during the daytime. Now, let's deal with pitted scars. Unfortunately, pitted scars cannot be treated by creams alone. Now, if you hydrate your skin or whether you're using any form of exfoliator, it does reduce the look of the pitted scars. However, the scars will still be there. Now, the best way to treat pitted scars are typically in-clinic treatments, things like chemical peels, and my favorite to treat pitted scars are glycolic acid peel or a TCA peel, trichloroacetic acetic acid peel. Now, just by doing peels once a month or once every 2 months, the appearance of pitted scars will reduce. Now, another way to reduce pitted scars is to do a surgical subcision, something that can be done in clinic, whereby a specialized needle that has like a blade at the bottom is put under the skin and it cuts the scars from the bottom, allowing new collagen to grow to take its place so that the pitted scars will then reduce and then slowly isn't that obvious. Next question, what kind of scars do I have? They are not raised, they are not submerged, just that the skin around the area is considerably darker compared to the area outside. Now, it seems like you have something called post-inflammatory hyperpigmentation, which is pigmented skin that occurs after a trauma. Now, why this happens is because there is a natural reaction by your skin. After a short-term trauma, whether it's acne or you've accidentally cut yourself or you've burned yourself, there is a little bit of redness and erythema around that particular area, and there's inflammation. And now, when the inflammation subsides, there is typically pigmentation that accumulates around the destroyed area or the damaged areas. Now, when that happens, typically the PIH do stay on your skin anywhere between a couple of months, even in some cases I've seen a couple of years. There is a way to actually get rid of them, to reduce them. One way is to start using niacinamide and vitamin C. How you do it is you apply vitamin C during the morning, and what vitamin C does is it reduces the amount of melanin already available on your skin. And using niacinamide at night, what it does is it reduces the amount of melanin that your skin will produce in the future. And then once or twice a week, you need to exfoliate your skin with a glycolic acid toner or a salicylic acid toner if your skin is oily. Now, if you do that within 2 to 3 months, typically the PIH will reduce and eventually subside. Now, to prevent future occurrences of PIH, what you can do is immediately when you have an acne or a skin trauma, you can always apply the niacinamide to prevent PIH from the early onset. Hi, I'm 6 months pregnant. How do I treat my belly for prevention of stretch mark? I already have 8 to 9 years of stretch marks around the hips. So this is a very popular question amongst women who are planning to get pregnant or who are already pregnant. Now, good news and bad news. Bad news is you cannot really prevent stretch marks around the belly, especially during pregnancy. Stretch marks are not scars on the top layer of your skin, but they are typically in the dermal layer or the hypodermis layer, which is the deep layers of your skin. Now, why that happens is because when there's stretching of the skin over a very short period of time, the collagen and the elastin in your skin tears and breaks. And when that happens, scar tissue forms very deep down and they become stretch marks later when the pregnancy disappears. But however, you can then slow down the appearance of stretch marks by moisturizing the skin. Now, if you do have old stretch marks, it means that after your pregnancy has disappeared and the stretch marks are still there, there are ways to reduce it after pregnancy. You could always use tretinoin or adapalene, apply on the areas of stretch marks. It does help reduce the amount of stretch marks because it helps to reconfigure new collagen growth. You could also opt for things like fractional CO2 lasers or radio frequency on the stretch marks to reduce the appearance of stretch marks. However, in most cases, stretch marks during pregnancy can be reduced, but it could not be prevented. I have a great time answering questions, so if you have any more questions regarding anything about your skin or skin-related questions, drop in the comments below and I will answer it during my next video. So if you like videos like this, do not forget to like and subscribe because it pushes this particular video to the algorithm. So it shows us that you love this kind of videos and I'll do more of that for you. Do not forget to subscribe and comment below, especially ask questions if you have any skin-related issues. That's it from me. I'm Dr. Ingky, your digital skin doctor, and always remember to stay safe, stay healthy, and most importantly, stay informed.